Good morning.
It's good to see you all. Come on in. We will get started here in just about 4 minutes. It's good to see y'all, and I'm seeing some familiar names and faces, so eager to chat with you today. Welcome, everyone. We see we have some more folks joining us. It's good to see you today. We'll get started here in just a few minutes. Welcome. We'll get started here in just a few minutes. Thank you all. Hi, everyone. It's good to see you. We are just at the noon hour. So I will go ahead and get started. I do know that we will have providers joining us as they're able throughout this time. So please feel free to come in and out as you need, as we know that you are all very busy and are joining us over. If you get a lunch break, hopefully, this is that time. So we are happy to see you all here. Thank you so much for joining us. My name is Sarah Minchell, and I am the Director of Innovation, Programs, and Strategy here at Child Care Aware of Kansas. And we are thrilled to be able to talk with you today and learn a little bit more about what your needs are as child care providers in the community today dealing with COVID. So I would just like to start off and thank you all. Thank you for your work. Thank you for your dedication. Thank you for your contribution to your communities. What you are doing today and every day is challenging, and it is so very important. So thank you so much for doing that. And I know you probably don't hear that very often. So I just wanted to take this opportunity. And I would like to let you know a little bit about what we are going to be doing here with our COVID series. So with the sudden surge of cases and a reintroduction of a new variant, we as a Child Care Health Consultant Network at Child Care Aware of Kansas knew that it was our opportunity to respond and knew that it was a wonderful opportunity to connect with all of you child care providers. So we want to use this session today as a fact-finding session, as an information session where we can learn more about what your questions are, what your concerns are, and what types of challenges you all are facing every day. So that is critically important to us as we move through this series. We want to make sure it is valuable for you. So today's goal will be really to learn some general questions and needs that you all have. And then we will build the rest of the series based off of that. So as you are answering questions today, know that the next couple of series options that we hold will be to answer questions, to guide you through some of that, some of the challenges that you've presented, and share resources as well. So as a health network, we have onboarded an RN, Erica McGinley, and she is here on the call today. And Erica, you can wave if you would like so everyone can see you. There she is. And we are thrilled to be able to have her expertise and health background to help us navigate the series as we move forward. So that is a little bit of a teaser for you all that we can use Erica's expertise and navigate COVID together. So why don't we get to it, because everyone's time is incredibly valuable. And I know that many of you are multitasking as we speak. So I would like to first introduce our Strategic Partnership Manager, Jessica Soto Boteo. She is going to be doing translation today for our Spanish-speaking childcare providers. So Jessica, if you wouldn't mind introducing yourself.
Sure. Hi, good afternoon, everyone. Thank you for being here. Muy buenas tardes a todas las de habla español. Bienvenidas. Mi nombre es Jessica y estaré disponible para ustedes por si gustan compartir su opinión. Lo pueden hacer llamando mi nombre cuando se pida compartir la opinión, o si gustan ponerlo en el chat, yo lo podré traducir o mandarme un mensaje en privado. Aquí estaré para ustedes. Gracias. Thank you, Sarah.
Wonderful. Thank you, Jessica. As we navigate today through the questions, please feel free to unmute and share if you are able. If you are not able to unmute and participate that way, please share your thoughts and questions and concerns through the chat. We will be gathering all of this information, as I previously stated, to build our series based off of your needs directly. We also want to make sure that we're planning this at a time that works for you all. So we did get quite a response for this lunch hour time, but I would love feedback on that as well. So if you are able next week to join us, if you can type into the chat, if you would prefer an evening or a lunchtime session, we can go ahead and use some of that feedback as well to inform our decisions. So as we get started, I would love to hand it over and introduce Heather Kosar, our program manager for the Child Care Health Consultant Network.
Thanks, Sarah. Welcome, everybody, and thank you so much for taking nap time. We know how valuable nap time is for you guys, so we really do appreciate you guys taking time to hop on with us, sharing your feedback with us, so we can truly build these series for you. So with that, we're going to get right to it because we have a lot of questions and we really want to hear from you guys. So Rachel, if you don't mind, if you could go ahead and start sharing your screen, unless it is already. I'm not going to lie, I am having some technical difficulties, so bear with me. Internet went out right, so we're doing this via phone for me today, but that's okay. So we have a series of 5 questions that we would love to just hear what your thoughts are and how you're not navigating things, where you need support on. But like Sarah said, feel free to unmute and talk. And if you're not to, you can definitely throw it in the chat. We will have people monitoring the chat and putting your comments up on our Jamboard and everything, so we don't lose anybody in the process of this and everything. So, but first I just kind of have to give a shout out to our funders. They're the ones who make this possible for us to do the work that we do. So KDHE in partnership with DCF, they really are the ones that are the backings behind this and supporting our charge and moving this forward and everything. So just a shout out to them first of all before we get started. But Rachel, if you could go ahead to the next slide. And our first question for you is, what are you currently doing to mitigate COVID? We just want to hear what best practices you do have in place, so we kind of know where else we can build on that. But if anybody feels comfortable unmuting and sharing, please feel free to, or again, the chat is an option as well.
Well, I'll go ahead. My name is Virginia and I'm the director of Modern Day Child Care Center. What we're doing, my teachers are wearing masks. I do have my 2.5-year-old preschool classroom, 2.5 and up, are wearing masks as well, as long as they are not eating or playing outside or napping. We did separate our tables long-wise, so when they are eating at lunch, the person across from them, there is nobody. We are all on one side of the table. And so we have parents coming in at different entrances, like the toddlers are coming, toddler parents are coming from my west door, and then the preschool parents are coming through the front entrance to kind of minimize the traffic congestions. Trying to think, we are washing toys, of course, during nap time and then after school. And I have this system that's called Maximum 256, and it's attached on to my water system where my employees will wash their toys, and this just goes on to my faucet and they turn it on, and it's our disinfectant solution on top of still, using our Clorox and bleach water. So that's what we are doing.
Wonderful. Thank you for sharing. Appreciate it.
You're welcome.
Anybody else want to share what they're doing to help mitigate the spread of COVID in their center?
I can go. We also have all of our staff, as well as our 3 to 5-year-olds, masked except while eating. And then outside is a choice to take off their masks as well. The parents do drop off at the classroom door fully masked, but then don't come in for dismissal. We've changed to a drive-through dismissal, which has been really helpful. When we eat, we spread the kids out around the room so that there are a maximum of 3 kids per table, so that, if we do in fact have an exposure or a positive case in a classroom, we are only quarantining a couple of other kids rather than the whole class or half of the class. We do tons of deep cleaning. Everyone washes their hands when they arrive and several times throughout the day, as I'm sure you all do. And yeah, knock on wood, we've been pretty successful so far.
Wonderful. And I'm seeing things come in the chat as well. So, and I see some couple of you have made a comment that you're currently closed and you're looking for ideas to just how to get yourself reopened. So that is exactly what we're here for, is we want to help you get those doors reopened, you know, share with you what best practices are and everything. So I'm so glad that you're in attendance on that. Anybody else want to hop in? Or Jessica, is there anything that that you would like to share from our Spanish speaking providers as well?
Sure, give me just a second. I'm pulling it up. I've just had comments saying that they try to keep the area clean, just doing daily disinfecting with toys and taking temperatures, constantly washing hands, disinfecting areas, again, taking temperatures. If someone inside the facility has a symptom, then they do the COVID testing, just to be sure that it doesn't get spread in their daycare. That's kind of just a summary of what has come in.
Wonderful, thank you.
You're welcome.
And I'm seeing our Post-it notes coming and they're filling up. So definitely keep things coming in the chat and everything. And I do apologize. I'm going back and forth on my phone from the chat to the screen. So, but hey, we're making it work, right? We're making it work. So Sarah, if you see something in the chat, definitely please chime in, my dear.
Yes, I see some trends. Absolutely. I'm seeing some trends with, I'm loving that some of you all are going ahead and putting in the chat there what specific needs you have. So that's going to really help inform our continuing conversations. I'm also seeing a lot of suggestions to discuss vaccination. I'm seeing a lot of suggestions about, of course, a lot of cleaning and sanitizing and masking. A lot of providers are also sharing their approaches to drop off and pick up to minimize exposure, because that seems to be a very big concern.
All right. Does anybody else want to hop on and share about what they're currently doing? If not, we can definitely go on to the next question. All righty. Well, let's go on to our next question then, Miss Rachel, whenever you're ready. Our next question is, how are you communicating with families what you are doing to mitigate the spread of COVID? You know, it's definitely important when families come into tour, they feel like they can drop their child off in a safe place, and that you are doing the best that you can to mitigate the spread of COVID and any illness in childcare. So what do you guys use for communication tools with your families? Anybody want to open up and share?
I utilize a lot of email directly to specific age groups or to the entire program, and then also posted signs on the doors for if anything's changed or just reminders.
Thank you. And I saw texting come through on the chat as well. So that is definitely a great way to utilize communicating that with families and everything. What about like touring families or new enrolling families? How what is shared with them of what you're doing if they're potentially coming into your program?
I am still doing some tours. I have done tours during this time, and I show them the procedure. I show them our system in our closet, how we sanitize. I tell them, I show them the charts of how we're taking temperatures daily. And what else? That, you know, we wear masks as employers, all our teachers. We encourage the children to wear masks that are 2.5 I do only have one parent that chose to opt out, and we told them that we respect their decision, that they do not want their 3-year-old to have a mask on. So.
Thank you. Thank you for sharing. Anybody else? How are we communicating with our families what we are doing? And Sarah, again, if you can help me with the chat, I would greatly appreciate it, since I'm going small screen today.
I had someone share, sorry.
Okay, sorry, go ahead, Jessica. Yes.
I had someone share just emails, just if when they drop off their children or pick them up at a distance, they kind of communicate that way. They also have developed text message group for the whole entire parents just to have access to, and that's where information is shared.
Wonderful, thank you.
I'm seeing a lot of really great suggestions for different apps that providers use in the chat. So there are a couple suggestions there that they utilize. Hi Mama, ProCare, Brightwheel, just a couple suggestions there from providers on different apps that they use to communicate with families throughout the day.
Thank you. Yeah, it's definitely, you know, important to share with our families when they're coming and looking for childcare, that they feel like they're leaving them in a good, safe place, or doing the best that we can to mitigate the spread of any illness in childcare. We know childcare is a germ fest, so we want to do our best to mitigate the spread the best that we can. And I still see things coming in on our Jamboard as well, so we'll just give you guys a couple more minutes to keep putting things in the chat. If anybody else wants to come off of mute and share what they're doing to communicate with families, and what's worked and maybe what hasn't worked for you. That's definitely important to know as well, because sometimes our ideas are great, but it's just not received necessarily the same way. So we just have to adapt and roll with it. So I see something about Brightwheel. Brightwheel I'm a fan of Brightwheel. It's something I used when I was a director. It's a great way to you know, get the word out very quickly if you need to on things. But not only that, keep them up to date on all the day-to-day stuff that's going on. So Brightwheel is a great technology-based way to connect with providers, or not with families. My apologies.
Someone shared that they do share licensing information and hand it out to parents so they are aware of the regulations and licensing requirements.
I do email my parents on what's going on in the center. The teachers also have a personal Facebook classroom that they communicate with their parents through that way. And of course, just speaking to them as they drop off, pick up, and of course, our daily sheet.
Sure. Thank you, Virginia. You know, I would like to actually pose a question to the group and see if you all have had to reframe the way that you just generally communicate with families, because you're not seeing them as regularly face-to-face due to the drop-off and pick up strategies that you have had to implement to mitigate COVID. And if you have any tips for your fellow providers on that topic as well, I'm sure that would be very, very valuable.
As a preschool, we only operate 2.5 hours a day, and with not allowing parents in our building, they don't get to see like what some of the daily activities are and different things. So we have a daily email that goes out as an activity, and it is our first communication, and it also helps to remind parents to be letting us know if children aren't attending, why they're not attending, and it's that full open communication that way. We also at the beginning, when the guideline came out, and then all of a sudden you've got different quarantining guidelines and everything else. Here recently, we said we're staying with the 10-day quarantine. The 5-day doesn't really work for preschool. We know it's an inconvenience, but we need we want everyone to follow the same and trying to track when somebody had a symptom and when somebody didn't have a symptom and all that. So we just said, this is our guideline that we're following. We sent all that information out. That KDHE, sent out a beautiful chart that's very easy to read, and we have that out. We don't allow anyone within in our area at all that's not masked up, because we are in a church. So anyone who enters into our area has to be masked. We recommend children to be masked, but they're not necessarily being masked, but like all of them, and we respect that. So that's why we also went with our quarantining being 10 days, since we have some parents opting out of masking and some not. We just needed to have it blanket for everybody. And it's worked really well for us.
Thank you so much for sharing that, Gina. And if you don't mind me asking, does the daily email come from the teachers or the administration? How do you all execute that strategy? Because I think that is a really great way to keep parents in the loop.
Right now, it's executed through me as the administrator, and so that is total open communication with me. And then it also can help with some of the confidentiality of that. I can share what needs to be shared and not necessarily share everything. And our parents, we also talked to them at the very beginning of the year about transparency with COVID, and just either don't send your child. We do the temperature checks, we do all of that, but being transparent with us, because you can't help whether or not your child gets COVID. It's kind of the same with hand, foot, and mouth, or lice, or any of the above. It's not anyone's fault. What we have to be able to let other families know that their child has been exposed to that, or our staff members have been exposed to that. So
Sure.
It's worked really well. And just asking parents to be very transparent. And then we redid our entire handbook, where it has a whole entire COVID section in it, where these are our protocols, and this is why we're doing the things that we're doing. We do a drop off in the morning, and we do a pickup in the afternoon, just to keep people from wandering around in our area and putting our littles who aren't old enough to be vaccinated at risk. And it also helped to mitigate fighting over, well, I'm vaccinated or I'm not, on who has to wear a mask. You're down here, you wear a mask if you're an adult. And our children from 3 to 5, we let our parents do that option. But having that option meant that we had to stricken down some of our protocols and quarantine time and that kind of thing.
Sure. Well, that was a really great share out. So thank you very much for all of your feedback. That was wonderful.
Thank you. And so we'll go ahead and move on to our next question. And if anything, you want to contribute, anything else you want to add to how you share with families, just feel free to put it in the chat, and we'll definitely get that up there for you. Our next question is, what barriers are you facing with implementing the best practices for childcare, for COVID mitigation? This is really, we want to know, is it, just knowing what the best practices are? That's kind of what's, is that a barrier? Is it understanding how to implement them? You know what they are, but you're not necessarily sure of the first step to take in order to get them. So we really kind of want to know what barriers are possibly hindering you from implementing the best practices. Any thoughts?
I can share some of the things that came in through the chat. That might spark some ideas and information from the rest of the group. But we did get some information on how individuals would like more information regarding mixed age groups. So if you're looking for information on mixed age groups, that's something that seems to be a bit of a barrier when you are looking at having some COVID mitigation strategies implemented. So that is a unique circumstance for some childcare providers.
And I know, just to kind of piggyback on one of the providers was speaking earlier, is the ever-changing, recommendations that are out there. That can definitely be a challenge to know how to keep up with it all, and when does it apply to you and when does it not apply to you, depending on the circumstances and everything. So that can definitely be a challenge. And I saw somebody put in the chat about staff. That is, I would echo that through the mountaintops. We definitely need staff for you. You need staff, and you need the time to work all of the best practices into your center so that you can do these effectively. So I couldn't agree more on staffing is a huge part of being able to implement this.
I had someone sharing that it's hard when a family has been exposed and they don't want to do the test, but yet they need care for their children. That is just that's a hard conversation sometimes with parents. I'm not understanding that, it's helpful if they get the test, and just temperature taking as daily basis. That's also a hard conversation with parents. That has been a barrier.
Definitely.
I'm just curious if any care providers or directors have run into those employees that are so dedicated and so gung-ho that even if they know, if they're honest with themselves, they're experiencing symptoms, they're still trying to show up to work just because they want to be a team player, and they know how short of staff we are right now. Is anybody encountering that? And if so, how are you navigating it?
It's a great question, Erica. Good question. Yeah, there's always the staff that are 100% dedicated to it, and they're going to come. I always say there's the staff member that's going to come on their deathbed. But we don't necessarily want them there. We want them to take care of themselves. All right, and I'm just reading that some things that are coming into the chat. Oh, I'm sorry. Go ahead.
Oh no, never mind.
Okay. And I'm seeing things that, because we have all different kinds of providers on this call. So we have, centers and home providers and, group homes and everything. And I'm seeing stuff about you're being by yourself. So, you want to do your best of, like one of the best practices I know that's out there is, you try to keep the staff member with that staff member as much as you can and minimize that cross-contamination, but it can be hard. You're the only one and you're kind of having to do it all. So you do your best to keep the young ones from the older ones, but you're that constant that has to go in between. So that is definitely a struggle for home providers for certain.
Mm-hmm. Yeah, I would like to piggyback on that and just share that, we are seeing that through the chat that providers are sharing that testing is a challenging conversation to have. And maybe navigating that with staff would be challenging as well. So I think that is something that we're seeing a little bit more of as well.
And Jessica, I see one of our Spanish speaking providers put something in the chat as well. Would you be able to share that with us?
Actually, that was me.
Oh, okay. Sorry.
No, it's okay. I just put that question out there that Erica asked.
Oh, okay.
In case they wanted to provide any feedback.
Well, I see a suggestion here from a provider that shared that she's in a small town, and she asks that her parents have backup care so that if there is an event that they cannot use her, they will have a strategy in place. And she said that that has gone pretty well for her families that she serves.
Great suggestion. Thank you. Anybody else have any thoughts or anything they'd like to contribute for this question before we move on to the next one? Haley just put a really good comment in there of tackling, parents being forthcoming about, if they've had a positive exposure, or they themselves being positive. That is definitely not an easy conversation to have, and it definitely would be something to figure out how to tackle, is when you have to have those hard conversations with that. And that's all righty. Well, like I keep putting things in the chat if there's anything relevant to this question. Otherwise, we will go ahead and move on to our next one. Our next question ties to what do you need help with? This we want to know what would be beneficial to you in implementing these best practices and helping you just know how to navigate COVID. This is really where we want to hear from you guys on what's going to work best for you. What kind of support do you need? What kind of resources do you need? Whether it be email, text, newsletters, talking with a child care health consultant, one-on-one, and they can help you navigate all of the crazies, that you have to do that come with this field. So what would truly be beneficial to you to help you navigate this?
I'm going to say maybe just to keep us updated on all these different, because I'm new to being a director. And this is my first rodeo, so I'm learning that. I mean, I've been in childcare for over 26 years. However, it's a lot different. So it was very confusing at me at first, whether I was following the 5 days or the 10 days. And until I spoke to Jennifer Zimmerman, I was like, okay, this is. So I think just trying to keep us updated if anything changes from KDHE, from the Shawnee County Health, like what, I guess, kind of just refresh so we would know. And of course, I'm trying to keep updated by reading the new guidelines as well. And then it would kind of help us. I'll be like, oh yeah, okay, I'll remember that I have to do this now, blah, blah, blah. They're changing this, or they're doing that. That's just for me being a newbie.
It could definitely get a little challenging with like we said earlier, like, okay, is it the 5 days? Is it the 10 days? When does the vaccine come into play? It can definitely be tricky. And that's why we're super excited to, be able to offer our nurse consultants as well to kind of help us navigate that a little bit more. So we have Miss Erica on our team who is phenomenal, and we're bringing on an additional nurse consultant next week that we're super excited about. So we'll definitely hoping that we can get some more clarification on navigating what is out there. Let's see here. Oh, and there's a bunch of things coming in the chat, and I'm trying to read them as they come in too.
I got you, Heather. I got you.
Okay, got you. Sorry.
Yes, I know it is difficult to read and talk at the same time. So I am seeing a lot of wonderful suggestions. We have providers asking for updates regularly as there are changes in guidelines and recommendations. There are also providers asking to explain things in a little bit more of plain language so that we can get through and navigate this a little bit better together. Also, I'm seeing just regular emails and check-ins, tests at the center or at the location of the program would be beneficial from providers is what I'm seeing as well. And it seems as though there's quite a struggle, and I can completely understand this because I think we all are trying to keep up with the ever-changing guidelines and how these variants are evolving and changing. So it looks as though providers are asking to have clear guidance, clear information, printouts so that they can post. And then looks like some providers are also suggesting some funds to help support the costs if needed when closure would happen.
And I saw something else in the chat that that really hit home with me is remembering that, you know, at the end of the day, our home providers, you are a small business, and it's to have things in place that protect you when stuff happens. So, you know, what's your policy when, you know, you have to close, you know, how do you still receive tuition, or vice versa, if a child becomes positive and they have to be out for their quarantine period, how does that handle you guys as well? So definitely policies and procedures. I always say you want to have them and not need them, rather than need them and not have them. So that was a really good shout out of making sure that we have things in place to protect our business as well, to, you know, make sure we can navigate this. And that is something else that Child Care Aware of Kansas offers as well. Our Child Care Health Consultant Network definitely focuses on health and safety, but we have a quality initiative called Links to Quality that really can help dive into the business side of early child care and making sure that you have things in place that can protect you when these times, not just when these times, but when any time comes on. So we can definitely, that is definitely something that we offer as well. So that was a great shout out for that. We got even more things coming in the chat here. So let's see here. Oh, somebody put they live in a town, but they're in 2 counties. That is interesting. You know, so counties have their own different, one county says one thing, one can be another. So that could definitely be something very hard in navigating. And I can imagine, you know, I'm thinking up in the Northeast, because Kansas City is split between states. So that can be a little interesting. I'm still new to Kansas, I say, so I'm still learning all different areas, but I at least
You knew that one.
in that.
It looks like we're seeing additional recommendations for grant access to programs that are only open throughout the school year. Also sick days, build in some sick days yearly for providers, and paid and closed holidays. That's a wonderful suggestion. Personal days would be welcome as well, so that you can take care of yourselves.
I had someone put in like COVID testing to give to parents so they could have some tests at home.
Anything else for this question?
It looks like we have printout requests and rapid or PCR test requests.
Yep.
I mean, you know, information and tools, right? So that makes a lot of sense.
Yep, on where they can go to get tested, and definitely. All righty. Well, if you think of anything else relevant to this one, just keep putting it in the chat. Otherwise, we're going to go on to the last question that we have. And our last question is, how are you staying up to date, or the best of your abilities? How are you staying up to date? You know, are you making connections with, you know, the local health department, your surveyor, school district, you know, your city council, with, you know, what the mandates may or may not be in your area? How are you just what are you doing right now to stay up to date on? Health department? They are our lifesavers right now, aren't they?
I just usually try to contact my survey
No.
and see what I need to be doing.
No.
Making sure I'm crossing my eyes and dotting my T's.
Yep.
Someone shared the news, health department calling their surveyor with questions.
Someone else shared that they follow school policies, local policies with the school districts in their area. And also someone did share a challenge in the chat that they're having a hard time enforcing the isolation and quarantine guidelines, and that families are having a hard time receiving that. So I think that those are important to share as well, challenges that you all are having. If anything's bubbling up for you as we're having this conversation, please let us know so that we can try to help form the series appropriately as we move forward.
Yeah.
I do have a question, and it's regarding, I know parents said that some of the kids, or some of the parents are not coming in the school. What do you do when you guys have other centers, when you guys have different times? I'm open from 6:30 to 5:30, and I have kids coming anywhere from 6:30 in the morning to like 8:30 in the morning, and then they're going home from 3 anywhere to 5:30. And we only have 4 classrooms here. So it's not a set time. We won't be able to have a drop off. What are the other centers that have that range of time like me doing? I guess I just wanted you guys' thoughts.
Definitely.
I'm still letting parents come in.
Does any fellow childcare providers want to share what they are doing? Otherwise, we can definitely share some things as well. But I want to give a chance for our fellow providers on here. All right. Well, I know something, Virginia, that I have seen providers do is, especially in a center setting, and this all goes back to staffing. So it can, that can be the kicker at the end of the day is, you know, because you have your heavy drop off times and your heavy pickup times, and no matter how much you try, there's going to be, you know, people are crossing in the hallway, in the classrooms, all that kind of stuff. If you, to limit cross-contamination, if you have the staffing ability to do it, it's not a bad idea to have them wait in the lobby or entranceway or wherever you have, and somebody is a runner. So you have somebody designated truly in the beginning during those heavy pickup times and those heavy drop-off times, that they truly are the runner and like, okay, Johnny's mom's here, let me go get him. That way you do try to limit that cross-contamination within that. I have seen that be I've seen it be very successful, but it does also come down to staffing. And if you have the ability to have somebody be a runner like that.
Right. Thank you. Thank you for that.
And I see somebody else also put about they have families, they wait in their car until their child is at the door. So then once they're there, they're, you know, it limits that, again, it limits that exposure. Let's see what else. I've seen a couple, they have their parents, they ask them to wait in their car, and then they either bring them out or they wait till they get a little bit closer. Let's see what else.
Looks like we have a suggestion. Someone shared that there's a doorbell at the locations where they go, and someone can ring the doorbell, and then parents are able to pick up and drop off effectively that way. I am seeing a lot of waiting in the vehicle and alternating. One family at the door only, they wait in the car until child is at the door. Runners in the AM and PM. You guys are trying, you're really creative and trying your best.
Right.
I definitely
Yeah.
see that.
Yeah. Anything else?
Another thing I've
ahead.
seen, if you don't have the staff to support like a dedicated runner, is to like in the facility-based setting, at least to have the parents wait at the classroom door so they don't go through the threshold. They wait there with the child until a provider in the room is able to come greet them and bring the child in through the classroom.
Thank you, Erica. Anything else on this one? Well, I'm gonna throw everybody a curveball here, because I said this was our last question, but I want to really just open it up for you guys and flat out ask, what do you want out of this COVID series? Like, what topics do you want to hear about? We have a registered nurse on our team, and if you want to talk to a registered nurse, we can definitely have a dedicated time for that. But really, what topics do you want to hear about or in this COVID series? And so, Rachel, I don't know if we could just go to the next one where it's blank, and if anything comes through, we can definitely just add it into that one. Sorry, Rachel, I threw us off there. But what would you like out of this COVID series? Symptoms, yep, navigating symptoms. And right now we're also in cold and flu, and I'm learning in Kansas, I think allergy season is all year long in Kansas, as I've been here almost a year now. I think allergy season's all year now. So that is definitely something. What else? What else can we help with in this series? Grants that are available, okay. Tackling the being vaccinated versus how long do you shut down for? That is definitely a very tricky time right now, as if you're vaccinated or not vaccinated, what's the quarantine period and everything. So definitely. What else?
And as you all are letting that percolate, I would just like to share with you that the Child Care Health Consultant Network is here to navigate through concerns that you have in relation to COVID and also health, safety, wellness. Really, we are here to support you all as childcare providers, and we want to be there along the way with you. So we are here to make sure that we can connect, we can do some goal setting, and we can tackle some things alongside with you all. And our consultants will be reaching out over the next week to the attendees of today's session to just connect and see what you need and how they can connect and best serve you and your program. So please know that you will be hearing from consultants over the next week, and they will be eager and excited to figure out how they can best serve you and get consultations underway if you would like to do that.
And that was actually my next slide was if you are in, you're okay, Sarah, you're good. Great minds think alike. But if you, that is what our network does, is we are here to help navigate you through this COVID time, but not just COVID, it's also, any health, safety, wellness needs that Sarah had mentioned. So we are more than happy to schedule something with you. So if you are interested in it, like Sarah said, we are going to be reaching out to you, but if you for certain, like, yes, I want to talk with somebody, feel free to put your name and your license number in the chat. And Tanisha, our program assistant, will be reaching out to you. We have consultants located throughout the entire state. So all of them are coming with, you know, health, ECE, public background. So they can definitely relate to the struggles that you are facing and help you navigate those and everything. So if you are interested in that, please feel free to drop that in the chat, and we will be in touch with you after our COVID series. So, and we'll get you going and everything. All righty. And then very lastly, we don't want anybody to feel like they're walking away without, you know, some kind of resources in hand. So after our series today, Rachel, the lady who sent you the link to hop on to this onto this meeting, we will be sending out you all of these resources, something for you to start peeling over, you know, just the more information, the better, until we're able, until our next COVID part 2. But we'll be sending that out as a follow-up information. We'll also have on there the flyer for CCHC and our contact information. So if you do want to connect with somebody locally in your area that can help you walk through all this, we will definitely be happy to do. Sarah's also thrown in the chat our website information, so you can go online and you know, fill out a form, and our program assistant will be in contact with you as well. But I believe Terry, did you have your hand up, my dear? Did you have a question?
She's saying no. She shook her head no.
Okay, sorry.
No worries. Yes, it is looking like we are getting some great suggestions for our next couple of sessions that we will have together. And as Heather mentioned, those resources will be coming to your inbox along with additional information. And we are really looking forward to connecting with you all. Thank you so much for your time today. I know how valuable it is. And we just are really grateful to get this opportunity to learn from you and hear what you need, so we can strategize how to serve you.
All righty.
Thank you.
Yeah, thank you. And if you think of anything else, we'll be around for a little bit, so you can just throw it in the chat. Otherwise, you have a great rest of your nap time to get some things done. I know how valuable that is. But thank you so much for tuning in with us, and we'll see you next time for part 2.
Thank you.
Thank you all.
Thank you. Thank you.
Well, should we stop the recording, maybe?
Yeah, I think we're okay now.
Okay.
So, all right. Bye, everybody.
Good job.